Case number 4 is from a 16-year-old male. Here we have a plain film X-ray, which shows a exophytic pedunculated mass in the distal femoral metaphysis. You note that this mass is continuous with the underlying medullary cavity, as well as it pushes up on and continuous with the overlying cortex. This mass is growing away from the nearby joint, up and away from that joint. And finally, you'll notice that the patient epiphysis growth plate is still open. So this patient is skeletally immature. Tissue was obtained, which reveals a proliferation composed of 3 separate components. The top left, we've got an outer perichondrium, this pink fibrous layer, which is continuous with the periosteum, underneath which is a fragment of mature hyaline cartilage, which has small chondrocytes superficially, which enlarge towards the base where it becomes continuous with the underlying bone, which is the third component. And this bone is continuous with the medullary cavity. The bottom left, we can see the chondrocytes are arranged in columns. More superficially, they're clustered, and as they grow closer to the bone, where it merges with the bone, they elongate, hypertrophy, and are arranged in orderly rows. And on the right, again, you can see the bland nature of these chondrocytes and see how it merges with the bone, and enchondral ossification, which recapitulates a growth plate. So altogether, this is an osteochondroma, which is the most common benign bone tumor. Typically, osteochondromas are seen in children or young adults. They may be seen in a solitary mass or in multiple osteochondromas, multiple hereditary exostosis, which is inherited in an autosomal dominant fashion. Osteochondromas are usually asymptomatic, but they can be painful. Osteochondromas typically occur in the metaphysis of long bones as pedunculated or sessile masses that grow in continuity with the medullary cavity. And as I mentioned, the tumor often grows away from a nearby joint. Histologically, osteochondromas are composed of columns of well-differentiated chondrocytes that forms a cap, again, recapitulating the growth plate. Osteochondromas harbor EXT1 or EXT2 gene mutations, and the risk of secondary chondrosarcoma is less than 5% in patients with multiple hereditary exostosis, meaning more than one osteochondroma, and it is less than 1% in solitary osteochondromas.